stings or it's
Oh, son of a bitch! It stings.
It feels better later.
cold? No, it won't. Let me get him. What allergies do you have?
None.
None. Give him like 2 milligrams of morphine.
Oh.
Just some pain medication.
Yeah, we got.
Just,
Got something besides morphine though.
they're all equivalent.
Morphine tends to give me headaches.
Headaches.
Yeah.
Do you remember to put it in, or do you want me to put it in as a verbal order?
Can you do it as a verbal and I'll co-sign?
What's your last name?
CHOW, Christopher.
Oh.
Normally it doesn't sting that much. I apologize, sir.
Oh. Normally I don't feel pain that much. I mean.
Do you really? Sure.
Oh wow, it's deep.
Yeah, it goes through the soft tissue.
A lot deep.
You get the picture
I didn't
you
even,
wanted?
Yeah.
All right.
I didn't even think your skin goes down that far.
It's right up to the muscle.
And numb you up. It's gonna be a poke and a burn.
People saying.
Alright, we'll let that work for a little while.
I just get chills. Whoa,
What?
your skin's like bulging out.
Oh yeah, that's where you put the stuff in.
Yeah. Never seen.
You can even take video if you want, Danny.
I am
care.
taking video.
Oh, alright.
That.
Okie dokie. I think it's so funny. You get so much into biology and how the human body works and all that.
Morphine. It's right here.
Yet you have no.
Okay. I'm gonna keep
It's the needle.
going, okay? Do you feel sharp or do you feel just pressure here?
Feel what?
Do you feel anything here? You feel that?
It feels like your finger.
Okay. But nothing else?
No.
Alright. That's good. Poking the needle at the spot we numbed up earlier.
That I feel. Yep. Felt like it was on the other side of the cut.
Yeah, it was on the right side.
Alright. Just keep me informed, not complaining.
As far as it's still bleeding.
Or that's the skin edges we've been
Yeah.
spreading apart. This actually has a little bit of epinephrine in it, adrenaline.
Ah,
So
Nice.
that'll help. What it does is it causes the blood vessels to constrict a little bit, and it keeps the bleeding down.
Really?
adrenaline keeps bleeding down.
If you administer it locally like this, the
Oh.
two reasons we do it are, one, it keeps that local anesthetic in a little bit longer, and it cuts down on the bleeding, so it gives us a little bit more food work.
Never knew that.
If you're using, like, if somebody's got like a cut on a finger or something, we avoid it because there's a risk that you would constrict off all the blood flow to that finger. So then you-
So
Down.
You got two of them.
Well, I'm down one.
One
Yeah.
eye.
So he's got a large lac here, then I'm just gonna do a 2-layer. The other one kind of extends in eyelids. I don't know if you want to do it. I can do it. It's up to
Wait.
you.
Yeah, it sounded
More
like
comfortable
we'll
if you would do it.
take a look at it and see, make sure it's not a canalicular lac or anything as well. It sounds like it's kind of right in the heart of those things. So,
Yeah.
how's your vision in that eye? So.
Having problems focusing.
Okay.
With it.
the same vision in both
Yeah, I
eyes.
can get it focused and read like I think I should, but I can't like read the whole line. It
Okay.
goes back out of focus.
Any double vision? I've seen two of things.
No.
I haven't really noticed that. Just not focusing. Okay.
How am I going to see two things that's slow? I can't open it really.
All right. You're just
No,
getting
actually-
started here. It looks like, huh?
Yeah, pop the stressing off. If you want to take a peek now.
You know what would be nice if I can just do a quick vision, maybe,
Sure,
and that
go
sort of
ahead.
thing, get them dilating.
Not a problem.
Actually, they already got a vision, right? 2040, 2070. I think.
Hey.
Did somebody have you do your?
We walked down
Read the
there.
Yeah, you
letter.
walked to the corner.
Yep.
Yeah.
I'm gonna run up and grab a couple things upstairs, and I'll come back down. So keep working, and then we'll take
Yeah.
a little break when I get back.
So my eye doctor is here, so all my records should be in my
Okay, you come here usually for your eye care? Okay,
Everything.
great. I'll look at that too before I come down for it.
Alrighty. Do you feel pressure?
This is low.
Pressure. You almost this is numbed up. So if anything changes, we can always give you more medication. Okay.
I've had stitches put in before.
You know the
without
drill,
any-
man.
What's
Not exactly
always
the same,
the-
but they correlate for the most part.
Well, like I said, when I broke my finger, they
That's how I knew when yours said 125.
just really did
So then why
not
is mine higher than
use
him?
any anesthetic on that fingertip.
It's you can't. They
Or
didn't. Or
worried.
you didn't.
They didn't.
Or worried.
The local anesthetic we're using now. I mean, you wouldn't want to use a year just because of the epinephrine in it.
Yeah.
But you can always use local without that, and it still works pretty well.
It's a hook.
But
Yes,
yeah,
it is.
he set the bone and stitched it up all without
Mm-hmm.
any anesthetic. And he said he could have, well, but strongly didn't
Partly it depends
really
on-
want to.
Yeah, partly it depends on how many stitches they ended up having put. Maybe it's only like 3 stitches. You
Oh, I
think if-
busted that little itty bitty bone in the end of your
Uh-huh.
finger. I broke that in half.
Oh. They put pins in it, or what do they do?
And I just put it in place.
Put in place and give you a splint.
So how about my eye injury? How'd they stitch that?
What happened to your
Microsurgery.
eye? You can actually
Um,
ask that guy about it. He's an ophthalmologist. He comes back. They use
Microsurgery.
probably a microscope. And suture that's thinner than your hair.
Beyond that, Danny, I can't tell you.
What happened?
He fell when he was younger with
Mhm.
a pen.
Mm.
And he was carrying it appropriately. Just like they had taught him that day in school.
Guess it
The only
doesn't.
problem with what they didn't teach him is if you are falling, let go. So when you're point down, you start falling, okay, up, point. Naturally flat.
I know.
The doc said he couldn't measure
Mhm.
the where the pen stopped and where the eye
Oh,
began.
wow.
So it got close.
Basically as close as you can get without. Yeah, he was kindergarten, first grade,
Mhm.
Second grade.
second grade.
No idea how old I was.
Do you still remember it?
Kind of.
Kind of.
Remember drawing thing, walking
remember.
out.
Yeah.
And
I
waking
remember
up in
how
the car.
freaked out I got when I went to United and they're like, we can't help you here.
United is scary for other reasons. At the university, since they have a lot of academic surgeons, we get a lot of cases referred from United. And some of them, it's like you hear about them and you're like, oh, crap.
I've actually. The only reason they needed to send him to Phillips Eye Institute,
Uh-huh.
you know. But
That's a good
I've
referral.
never had any complaints with the care I've gotten at
That's
United.
good.
Now I get all my care here, but
All that I
What part of the armed services did you serve?
Air Force,
Air Force? When was that?
83 to 85,
Uh-huh.
till I got sick.
So the important thing they always teach us when we're sewing is that you want, on each side, you want to be at the same level. So if you put a stitch, so imagine the
directly
tissue's like
across?
dipped, yeah, if
Oh.
it's this deep. If you don't put them directly across, when you pull it together, they're gonna mismatch and the scar's gonna look worse. So
It's going to look much more like a zipper than it should.
exactly. And the actual size of the bites is not as
ooh, air bubble.
yeah.
Nothing. I cannot believe you can barely feel that.
Huh?
Well, that's the joy of
Yeah, it's kind of amazing.
local anesthetic.
It's like
Well, actually, that one I did feel something.
Yeah, I can give you a little bit more
Oh, no pain. Just
pressure or stinging.
That hurt.